Hi, I'm a medical student in my final years. Today I will try to explain heart failure, and maybe in the next videos I will try to explain ECG and maybe the rest of internal medicine and cardiology. So, what is heart failure? Heart failure means inability of the heart to pump a sufficient blood to the body. That means, for example, if the body demand it's 5 liters and the heart only pump 4 liters, this is called heart failure because the heart failed to provide the required amount of blood. What are the causes of heart failure? It could be hypertension, it could be ischemic heart disease, it could be valvular heart disease, it could be congenital heart disease, and maybe cardiomyopathy. And the last one is suspected after excluding all above options, and it's detected by echo usually. So there are two types of heart failure. There is acute heart failure and there is chronic heart failure or congestive heart failure, let's call it. Also, there is left-sided heart failure and right-sided heart failure, or it could be both, left and side, the whole heart. Left-sided heart failure may cause lung congestion when the blood here is builds up and go back, so the lung is congested, and this reflected as symptoms such as dyspnea, breathlessness, orthopnea. Paroxysmal nocturnal dyspnea means the patient is wake up during the night, nocturnal, because he cannot breathe. Cough, hemoptysis due to congested vessels, hemoptysis, a cough of blood, bilateral basal fine crackles or crepitation, especially on the left side, the left lung. It could be low cardiac output symptoms. Both of the left side and right side cause low cardiac output. Low cardiac output symptoms, decreased blood perfusion to the body, results in exertional dyspnea, dizziness, and headache due to decreased perfusion to the brain. Oliguria means urine during the day is less than 400 millimeter. Blurring of vision, syncopal attack, and fatigue. What about right-sided heart failure? Right-sided heart failure results in systemic congestive symptoms such as dyspepsia, edema, when the blood here builds up and go back through the superior vena cava and the inferior vena cava. And if it goes superiorly, this will result in congested pulsating neck veins here in the neck. Okay. And edema, ascites, if it goes down, that's cause ascites and edema in the leg. So each side has its own symptoms. Okay, now let's talk about the mechanisms of heart failure. According to the causes of heart failure, this could be the problem, heart failure, in the systole and during diastole. So the other types of heart failure is reduced ejection fraction, means when the amount of blood is less than 40%, ejection fraction is less than 40%. This is called systolic heart failure. And this occurs due to decreased contractility, means the ventricles here cannot contract. There is a problem in the muscles The muscle cannot contract. And this is due to myocardial infarction, dilated cardiomyopathy, endocarditis, and this is rare. Yes. So there is a problem in the myocardium, and thereby the ventricles cannot contract to eject the blood. So what happened? The blood cannot go out. So this results in decrease in the ejection fraction. The blood that goes in outside the ventricles is less than 40%. And this is called heart failure reduced ejection fraction. There is a problem in the pushing of the blood, pushing the problem. While here in this type, the ejection fraction is larger than 40%. Here, these muscles are intact and strong. They are trying too hard to push, to squeeze the blood during the aorta or the pulmonary artery. But the problem that there is here at the door, the aorta, is kind of closed. There's hypertension. Try to prevent the blood from going here and bulge up. Okay? But when the ventricles squeeze too much, there is a blood can just come over and goes through the aorta to the body. So the ejection fraction is larger than 40%. And the problem was in filling. So this is filling problem. Diastolic heart failure. It's called preserved ejection fraction. Such as causes such as hypertension, mitral stenosis, pulmonic stenosis, pulmonary hypertension. Here hypertension, or it could be here. There's maybe mitral stenosis. There is maybe pulmonic stenosis. Okay. Auscultation. During auscultation, we're gonna hear S3 gallop, which results from inability of the ventricles to extend in order to receive more blood. S4, we hear S4 gallop, which results from the atrium trying to push the blood towards a tough ventricle. Both of S2 and S3 occurs in diastole. We hear also murmur sounds, and we feel and we hear tachycardia, horse steps. Normally, there's tachycardia in heart failure patient, but when there is a bradycardia instead of tachycardia, we suspect that there is underlying cause such as hypothyroidism. Hypothyroidism, as we know, it causes bradycardia. Maybe there's complete heart block or third-degree heart block, cause bradycardia also. Digitalis may also cause this. The investigations, we make lab tests, blood gas analysis. We notice increased liver enzymes, increased white blood cell count, increased urea and creatinine, and brain nitrouric peptide. Then we do ECG, left-sided heart failure ECG. We notice on the ECG left ventricular hypertrophy. The summation of squares of V1 and V6 larger or equal to 35 small squares. While in right side heart failure, we notice right ventricular hypertrophy, positive waves in V1. Normally shouldn't be positive wave, normally V1 should be negative. And I will explain this in ECG in the next videos. What about X-ray? We do X-ray. We notice that the heart is occupying third the chest cavity, 1/3 of chest cavity. This is the normal. We notice here in this for patient with heart failure, we notice that the heart occupies half of the chest cavity, and there is lung congestion here. We make echo to notice the size and function of the heart. What about the treatment? Of course, the nutrition. There should be a salt restriction, as we know salt, because salt contains sodium, and the sodium increase the preload and water on the heart, and the heart is exhausted, and the salt just increase the preload of the heart. So we need salt restriction. Treat the precipitating problem, such as thyrotoxicosis, arrhythmia, anemia, infection, thiamine deficiency, because these are leading to massive vasodilation. Thiamine deficiency in patients who are consuming alcohol in large amounts, and thiamine deficiency is vitamin B1 deficiency, because beriberi, which affects beriberi disease, affects the heart and increase the volume of liquids. We treat the underlying causes such as mitral stenosis, hypertension. Let's talk about the drugs. We use diuretics, aldosterone inhibitors, angiotensin converting enzyme inhibitors, angiotensin receptor blockers, beta blockers, angiotensin receptor neprilysin inhibitors, and ivabradine drug. Digoxin, amiodarone, antiplatelets and anticoagulants, SGLT2 inhibitors. So the drugs in red color, thiazide, chlorothiazide, and hydrochlorothiazide, and loop diuretic, furosemide, bumetamide, and ethacrynic acid, and digoxin, amiodarone, antiplatelet, and anticoagulant. These drugs in red means that they don't decrease the rate of mortality. They only relieve the symptoms of heart failure, the current symptoms. While the aldosterone inhibitors and vasodilators and the rest in the black, they improve the life and save lives, decrease the rate of mortality. I just want to explain the angiotensin receptor neprilysin inhibitors, which call it Interesto, like some Spanish. This is the mechanism. Angiotensin receptor neprilysin inhibitors mechanism. Let's suggest Pepsi is peptides. Here is the neprilysin, just kill the peptides and angiotensin. This is the drug, acylbutyrylate, kill the neprilysin. This is drug. This is drug, angiotensin receptor neprilysin inhibitors, such as sacubitril, kill the neprilysin, thereby saving the peptides life and angiotensin. Angiotensin in this case is not good, so they will increase. So we need angiotensin converting enzyme inhibitors here in this case with this drug. Thank you. I hope you get benefits from my explanation. Thank you for watching.